I love it here and I don't imagine myself working anywhere else.
It's a lovely hospital to work in, very friendly, community feel to it. So yeah, I've remained here for 20 years so far.
I actually can't believe the amount I've learned in the short time I've been here.
We're such a good team in critical care.
Intensive care can be very daunting to new staff, but it can also be one of the most joyful experiences you will have as a nurse.
So our department is quite unique in that it comprises of 3 separate areas, one of which is high dependency, coronary care and intensive care stabilise and transfer bay.
Critical care kind of consists of intensive care and high dependency. I work in high dependency. Main kind of differences are in ICU it's 1-to-1 care, whereas in HDU it's 1 nurse to 2 patients. It's kind of like working in a ward and an intensive care kind of combined to get kind of both aspects of it, which is enjoyable.
So it's a 9-bedded, newly developed department. It has full facilities to provide all intensive care needs.
We know if someone has to come here, the most sick in the hospital, they need the most amount of care.
A lot of people are like, oh my goodness, it's intensive care, it's coronary care, oh it's high dependency, I couldn't work there, but anybody, you could.
It's nice to have nurses coming with acute skills, acute nursing skills, but we also take nurses who are newly qualified, for example, who have never worked in an acute post as a registered nurse.
I started off in general medical ward for 2 years and came up to critical care, and that's been here 3 years now, just for more experience.
For a new start coming into our area, we do have practice educator support within their supernumerary periods, and we do have devised competencies that the staff member would work towards, and we do have a lot of experienced staff within our ward that can continually support, educate and help a new member of staff.
Once a month we get the opportunity, it's called Comfort and Coffee, and we sit and we discuss how we felt that month, and that is really good because you think sometimes you're the only person that's maybe struggling or feeling it a wee bit, and it's nice when consultants are saying that I really felt that really hurt me.
So we've now started running Inspire, which is where patients come back and they have follow-up, and for them actually to come in and be able to speak to us and tell us how they're doing, how things are with their family, who we've obviously get very close to as well. I think it's those sort of days that throughout my many years in the tech have kept me going.
In all honesty, I don't have the stress that I used to have working in other areas. You feel so well supported here.
I think the support that's offered specifically to new nurses to intensive care is something that we should all be very proud of within the Royal Alexandra.
Clyde Royal is a unique hospital, it's a community feel, it's very friendly, as is our ward. You know, it's fast-paced, lots to learn, the skills that you will learn and support from other members of staff is invaluable. So it's a worthwhile area to be part of.